Is bunion surgery my only option if I've got a bunion? The answer is no. Make sure you watch this video and I'll take you through why surgery is not your only option. In fact, it's your last resort if you've got a bunion. My name's Daniel Fitzpatrick from Sydney Foot Solutions, and we have been treating bunions successfully without surgery for over 20 years. In fact, we see well over 100 bunions a week through our clinic. We see stacks and stacks of bunions, and I'm going to talk to you through you now about surgery versus what we do and when it's indicated, and how you can avoid surgery for your bunion if you wish, of course. So just for the record, surgeons do a great job at bunion surgery, and the top surgeons in our area will openly tell people that surgery is the last resort and surgery is traumatic to your foot. And it's not that they do a bad job, it's just that surgery is next level and it is involved. And so as a result, we do see lots and lots of bunions because many people are very motivated to avoid the need for surgical intervention if they could avoid it, particularly when it comes to their bunion. And so you might say, well, how do you help avoid surgery for a bunion? Well, the way that we do it is that, and it depends on the individual, we obviously first assess the person. If it is indicated, we often send for weight-bearing x-rays, which allow us to measure the level of misalignment. And then from there, we come up with a treatment plan based on what we see. And often that treatment plan involves a very gentle hands-on technique. It's called foot mobilization therapy. And we combine that with exercise therapy. And the advantage of that is that we can help to improve the function that helped to cause the bunion in the first place. We strengthen the tissues, and we also help to pull the big toe back into a better position long term. So that process is usually quite successful if it's used in the right cases. And in fact, we do stacks and stacks and stacks of bunions. People come to see us all the time. So the problem is that if people leave it too long, then their only option is the surgical intervention. And keep in mind, just because your bunion doesn't hurt you yet, the odds are it probably will at some stage. So I hear all the time, oh, my bunion doesn't hurt me, so I'm not going to do anything about it. And then it gets to a point where it starts to dislocate, and the only option is reconstructive surgery to start to pull it back into a better position, where they have to actually break all of these bones and repin them. And the problem with that is that there's a huge amount of pain involved. The cost per foot is usually about, well, a patient told me the other day about $7,500 to $8,000 just for surgery fee on 1 foot. And the recovery, you are off your feet for 6 to 8 weeks. So the huge advantage of what we do with foot mobilization therapy, yes, we can't cut off the lump, but we can definitely help to improve the alignment of your big toe and improve the function and improve the underlying cause of why you've got a bunion in the first place. So the big advantage is there's no downtime, it's a fraction of the cost. You can keep wearing whatever shoes you want, you can go barefoot, you don't have to wear orthotics. So there's a whole range of benefits of foot mobilization. The other thing is the foot mobilization, it doesn't hurt, it's very quick and very light, and then you just do, the exercises take about 3 minutes a day. If I seem confident that this can help people with bunions, we often take before and after x-ray to actually show those differences. So definitely, if you have any questions about your bunion, we'd love to hear them below. In fact, we see stacks and stacks and stacks of bunions, and we know that the surgery is definitely, in many people's mind, the only option. The reason I made this video is just to enlighten people so that they are aware of it. And just remember, the real takeaway from this video is if you do have a bunion, it's best to get professional advice and get it checked out sooner rather than later. If you get your bunion checked out sooner rather than later, you have many more options. The problem is if you leave it and your bunion keeps creeping across, even if it doesn't hurt, eventually the bunion will probably dislocate this way. And if you want a good guide, have a look at your, say, grandmother or mother, because bunions, the genetic trait that is passed with bunions is usually comes from the female side. Not being sexist, it does normally come from that, can come from the male side, but usually it's the female side. So if you don't want a bunion like your mother or grandmother, then it's definitely best to try and get onto this as soon as possible, particularly if you want to avoid the surgical intervention, you want to save yourself thousands, and also you don't want that, you can't afford the 6 to 8 weeks off your feet. And let's face it, many of us cannot afford the 6 to 8 week recovery that is associated with the bunion surgery. So if this sounds like something you might be interested in, make sure you check out our special offer, 60% off initial assessment bunion offer. I'll put it in the link below. And also, please feel free to download our free top tips to avoid bunion surgery, bunion report. click on the link below. And please, if you like this information, we've got stacks of great helpful videos on bunions. Click, like, and subscribe our channel.